So in my last video, I talked about if you're having ankle sprain in 24 to 48 hours, how can you decrease? But now let's talk about ankle sprain. If you're having ankle sprain more than a week, okay, how can you decrease the pain? It's still same step, but the modality will be changed. All right, in the other video I was talking about using ice pack in 24 to 48 hours, but in this video we are talking about using hot pack, because after it has been a chronic case, you don't need to use ice pack, because ice pack would only be more effective in the acute case. All right, so hot pack will bring what we call vasodilation to the area, and the area will be inhibited by your antibodies, and these antibodies are the one decreasing the pain. Hot pack, you can use hot towel. Ice pack, you're using ice block. All right, so that is the major difference. Now, so the vasodilation is in that area of your ankle. Then what can you do next? What can you do forward is, once the vasodilation has come, you notice that the pain will decrease. But if it's not completely decreased, don't worry about it. Tomorrow continue with the technique of placing 2 to 3 minutes of the hot pack in that area. Now we go back to our strengthening exercise. You're not doing just strengthening exercise on the ankle, you're doing the strengthening exercise or resistance exercise on the both your hip, thigh, your knee, because if you're having ankle sprain and you are a soccer player, if you're doing strengthening exercise just on that ankle, it will cause issues with the other muscles, because the ankle will be more stronger and the imbalance will be there. So if you're doing strengthening exercise in over the places, it will be more better. Now don't forget, you can use strengthening exercise if you're not playing a game that very day, or 2 days from that very day where you're doing your treatment. But if you're having a game that very day, then I'll advise you go with soft tissue release, because if you go and start jogging, all right, there is more chances that the ankle sprain might reoccur. So if you're using soft tissue release or myofascial release, you're putting your hands, you're applying the gel, like this is the ankle. After the pain, you've applied your hot pack. So after you've applied your hot pack, you put the gel, then this is your ankle joint, all right, this is your knee joint. Then you're using a gel or a liquid that will allow you gently scrub your muscles, the soleus muscles, the gastrocnemius muscles, the hylicus muscles, the tibialis anterior and tibialis posterior, all the muscles around the ankle joint, even the tendon, I've forgotten the name of that tendon, the big tendon at the ankle joint. You should work on that too. So all this should be worked, like you have to release them. You have to release them from different parts. You're releasing, you can hold it and you can compare. You know that it will be more softer after you've done this technique for a very long time. Or you can, release in aspect of hitting, like this is my leg, I'm hitting like this. We do this in all the in football too, just to release the muscle if it's tight and something. All right, so the difference between this and that other technique of 24 to 48 hours is that this is after 1 week you're using hot pack. After during 24 to 48 hours period, we're using ice pack. That is the major difference, but the treatment is just same. But don't forget, assess for what I spoke in the other video, where you have to assess if the pain is a pain that irradiates to the other joint, or if you have a defect in the other joint, like knee and hip, because if you're having issues like that, it will cause ankle sprain. And even if you work on the ankle sprain, that issues are still there, it will still be resulting to pain in the ankle sprain. Thank you for watching.